Now, whenever we have a psychiatric problem at our hand, there is always a treatment, there is always a way to get that person or to help that person to get him out of that particular situation. Over here, we're talking or we're regarding the drug addicts and how can we help these people to get out of that particular kind of a drug addictive phase. Now, the person has basically started taking that psychoactive substance and he's basically addicted to it. Now, this addiction can be psychological and it can be physical as well. So if it is a psychological dependency, it can be treated through the psychotherapies only. Counselings are more than enough for these people, and we can help him get out of that situation by simple steps or simple techniques that he can be taught into. And then if he has developed the physical dependency, that is basically a more advanced stage of addiction, then these counseling sessions has to be taken into account. Then we can include the CBTs, that is the cognitive behavioral therapies, as well as we can also inculcate pharmacotherapies along with the counseling sessions. And that will be really helpful for that individual over here. So we have a range of pharmacy that is quite helpful whenever we are dealing with these drug addiction cases. Obviously, we are focusing on the withdrawal symptoms. How severe is the withdrawal symptom? That is again very important. History taking is again very important whenever we are managing a case of drug addiction. What was the cause for the start of the drug addiction? Was it some kind of a psychiatric problem, or was the person going through some sort of a depressive phase in his life? So we can basically, the post-traumatic stress disorder, is he schizophrenic? Is he having some psychiatric ailment? That is again very important. History taking is the mainstay over here. Whenever we are managing a case of a drug addiction, that will basically lead the case and we'll be easily managing the case afterwards. And what treatments we can devise in that particular case, that will be decided later on. So in this section, basically, first of all, we'll have to assess the patient, what kind of an addiction he has, what drugs he's using for the drug addiction, and then what is the severity? Is it of a milder form? Is it of a moderate form? Or is it of a severe form? So the psychotherapies, again, they are very important. And then the pharmacotherapies are again very important whenever we have this drug abuse treatment at our hand. The components of good assessment, they basically include acquiring comprehensive substance misuse history. So history is the mainstay over here, the complete history. The personal traits are even going to be discussed over here, and they are going to be inculcated whether the person was susceptible to this drug addiction phase or not. The understanding current social circumstances are again very important. The details about the current licit or illicit substance use, what is the variety of drugs that he's addicted to. A person can be addicted to more than one drug, or it can be an addiction to a variety of drugs. So we have to figure that out. The potential interventions that can be used in this particular case, the degree of social and community support is again very important. You have to ask, you have to assess that particular patient. These are basically the different phases of assessment that we are going to see. Asking is basically the history taking that we have already focused on. Then the assessment is done, and then the advice is given accordingly. The assistance are provided. It can be through the counseling, through the pharmacotherapies, and then we can arrange different counseling sessions with that particular patient to get him out of that difficult situation that he's experiencing. The available treatments are psychological approaches. Then the treatments of opiate dependencies, they are treated differently because it's basically a psychoactive drug. And then the alcohol consumption, alcohol, smoking, they're basically socially acceptable in a lot of societies. And so to take that person out of that particular kind of an addiction, it's again very important and again very pivotal. Smoking is another big group or a big category that we have to deal with working as clinicians. Pivotal to treatment effectiveness. So basically, you have to assess whether this particular kind of the drug addiction is pivotal to the treatment of effectiveness or not. And then the standardization of approaches is again very important, and it's quite complex in a lot of individuals because it's not basically a straight line that we walk through. There are multiple problems that a person is facing. It can be his personality, it can be his psychiatric illness, if he has some comorbidity, for example. There are a lot of cases of schizophrenia, there are a lot of cases of bipolar affective disorder, then depressive phases are there. So the person can also be experiencing these as well on the other hand. So we have to deal multiple cases in a particular instance that we're talking about. So this is again very important to assess what kind of therapy will be effective in that particular case. To provide support from different agencies or housing. So in-house treatments are quite in fashion. Basically, there are a lot of housing institutes in which you basically hire these drug addicts, and then you constantly counsel them, and then you constantly provide them an environment in which they can be taken out of that drug addictive situation. The treatments, basically the treatment philosophies differ, and they differ according to the clinician who is treating that particular case. There is a series of stages. It can be the preconception, the contemplation, then preparing the patient to get treated, and then the action and the maintenance is again very important over here. So the states of changes, the counseling may be quite appropriate. Then there are a lot of behavioral therapies, for example, the CBTs that involves the cognitive behavioral therapies, the self-control training, and the motivational counseling, the marital therapy and belief interventions, stress and contingency management, community reinforcement, cognitive therapies, and as well as cognitive behavioral therapies are inculcated to get that particular person out of that situation. Now, if you take a look at all of these range of treatments that are available, there are pharmacotherapies along with the behavioral therapies, and then there is a combination of these pharmacotherapies as well as this behavioral therapy on the other hand. The brief interventions can be the acronym frames. Personalized feedback or assessment is given, emphasizing individuals' personal responsibility for change, giving advice on how to change, providing a menu of options for change, expressing empathy through behaviors, and emphasizing self-efficacy for change. So it's again very important, these interventions through the behavioral therapy, they are made to bring that change in that particular person. Pharmacotherapies, they include the emergency dosages to conclude that fits kind of a stage, detoxification and withdrawal syndromes. Substitution drugs are given, relapse preventions. Then there are drugs for the treatment of the vitamin deficiency and the comorbid psychiatric disorder. If the person is suffering from these comorbidities, he's giving those drugs accordingly. The comorbid physical disorders are also given, for example, if the person is suffering from HIV or any chronic disorders, for example, hepatitis B or hepatitis C. The points that we have to consider, they include basically the need for the holistic approach. So the complexity and the continuity is again taken into account over here. And then the unpredictability is also taken into account. The person basically can react to these treatment modalities in different ways. The risk factors, and if the person has some sort of vulnerabilities, that are also taken into account over here. Then the need for support and supervision. So basically it's the community as a whole, and even the friends and families can be involved to take that person out of this difficult situation. So the severity, again, it can be the nature of the medical psychological severity, and then we can have the substance misuse. What kind of a substance he's taking for misuse? There are multidisciplinary team interactions, and the relationships between inpatient statutory services are also very helpful. The dilemmas of disengagement in the vulnerable groups. So he's basically stopped into going into those vulnerable groups where these drug addictions are quite common, and that is again going to be quite helpful in taking him out of this difficult situation. So in this section, basically, we discussed the different treatment modalities that are available for treating a patient of drug addiction. So that is the end of this section. Thank you for watching sqadia.com.